We'll get started because I know you're all on a schedule. Most of you are on a schedule. Thank you so much for coming today. My name is Dale Nickerson, and Twyla Averdy is also here, and we are SHIP counselors. And so we're going to present to you a lot of information about Medicare. And usually by the time we're halfway through, everybody's eyes are glazed over. So hopefully, even if you're eating, you'll still be awake by the end. So stick with us, and we'll try to breeze through things. I should warn you that our slides, this is a new PowerPoint presentation, and you're the first people we've presented it to. So if we kind of stumble, forgive us. So let's get started. So I gave you an idea of who I am. I assume since you all work here, you know where to go if there's an emergency, so we'll skip that. Questions. We will welcome questions as we go along. Sometimes we give a break halfway between because I'll be doing the first half of the presentation and Twyla will be doing the second. So we'll kind of give time for questions feel free if you want to write them down, or if you're the kind of person like me, you forget what that question was you were going to ask it when you have it, okay? So let me give you an idea of what SHIP is. It has nothing to do with sailboats or ships, except for it does have a navigation to it. And so it stands for Senior Health Insurance Information Program. We have volunteers in just about every county that add up to actually over 400 volunteers in the state, like Twyla and I. Our counseling is free. We do not ask for any remuneration for it. We have an office in Des Moines that is part of the State of Iowa Insurance Division, so we have accountability to them as well as to Medicare. We're trained, before we can even start, we have 40 hours of online training, plus 2 to 3 times shadowing a fellow counselor who has the experience, and then we have 10 hours of update. So that gives you an idea of just how complicated Medicare is. Our office in Des Moines are employed, and so they are our experts. If we get stuck, we call them. They're available 8 to 5 as we meet with our appointments. It's also confidential. What you say to us remains with us. We don't talk to anybody else about this terrible person whose name is. No, we don't do that. Also, all of the information that you give us that are written or through the computer are under lock and key and password protected. And the other thing we want you to know is that we're objective. We do not recommend any specific agency or insurance company to go with. Our job is to give you the information that you need so that you can make the right decision in your Medicare path. So this gives you a little idea of what we're going to do. First of all, we're going to just start with the basics. Just what is Medicare? All these Part A, Part C, Part D, what they all stand for. You have Medicare choices. You're going to have some choices to make when you enroll in Medicare. We're going to talk about that. Then we're going to talk about eligibility, when you should apply for Medicare. Are you eligible? When you will be eligible, and how you enroll. And then we have lots of resources that are available to you, just like some of them are also available to us. So let's start with the basics. I'm sure if you know anything about Medicare, you at least know you've heard Part A, Part B, Part D, Part C, all of those thrown around. And we're going to delineate them so that break them down. Part A is hospitalization. So at any time you go in the hospital, Part A will pay all but that. We'll talk about the cost later, but it will also cover skilled nursing. If you leave the hospital and have to go into skilled nursing, it will cover that. There's some home health care that's available for paid by Medicare, as well as hospice care. Part B, as in boy, is medical insurance. And that's your doctor's outpatient services, including surgeries, labs, x-rays, physical therapy, occupational therapy, emergency room. If you're going to the emergency room, Medicare will pay that. Again, and also some home health care and medical equipment, wheelchairs, walkers, and CPAP machines, oxygen supplies. So that's A and B, and that's the That's really the root of Medicare. It starts with hospitalization and medical insurance. Then there's C, which is Medicare Advantage, and that is so different than everything else that we really pull that out and talk about that towards the end of our presentation. And Part D, you've heard about prescription drug coverage. That's Part D. There's plans to choose from. Again, this is where your choices come in. Choosing what company to go to for your insurance, how much the premiums are, how much your copays are going to be, will all determine what company you go to. And then last of all is Medicare Supplement, often called Medigap, because as you will learn, Medicare doesn't cover everything. You're still responsible for some of your medical expenses. And if you go with the Medicare A and B, which we call or original Medicare down there on the bottom, you will want a supplement as well as a Part D. So supplements are all supplements, and Medicare Advantage are all offered from private insurance companies. Here's a little bit, gives you an idea when I said Medicare doesn't pay for everything. So hospital insurance, Part A, has a benefit period. It's not based on a calendar year. It's based on 60 days of hospital care. So you go into the hospital and you will be responsible for, over here on the far right, this year it would be a deductible of $1,632. But because it's based on a benefit period, you could have more than one deductible. So let me give you an example. If you went into the hospital tomorrow, which is March 6th, you would be first responsible for that $1,632. Like all deductibles, you pay that first, then Medicare kicks in and they will actually pay 100% of the first 60 days you're in the hospital. So you're in the hospital on March 6th and you get out March 12th. So for 60 days, when you don't have hospital, so let's say you don't go back in the hospital for the next 60 days, 2 months, but then come September, you have something else wrong, or it's a complication of why you were in the first place, that 60 days is over with, 2 months is over with, and a new benefit starts, and you would be responsible for that deductible before Medicare kicks in at 100%. It also covers, like I said, skilled nursing and then home care, and this is what they'll pay. Medicare does pay 100% of the first 20 days you're in skilled nursing. After 20 days, then you have a co-insurance. Part A, this is the best part when we talk about cost. Part A is free if you have 40 work credits or 10 years of work in your belt, under your belt when you retire. So there's no premium for Part A. If you haven't worked those 10 work credits, 10 years, but you have a spouse, you could be eligible for that under your spouse's insurance. Everything that we talk about as far as what you need to do and when the deadlines are Social Security makes those determinations. We're going to move on to Part B, medical insurance. Again, doctors, outpatient surgery, and other services. There's a yearly deductible, so you will pay this year $240 deductible, the first $240 of your medical bills, and then after that, Medicare pays $80. So you'd be, for Part B, you're responsible for a deductible plus a co-insurance of $20 on all the services, 20% on all the services that occur in the year. There are preventative services that Medicare has established, and there's a whole list of them that we didn't even put here because you can always go to Medicare.gov and find it, and it's also on our SHIP website. So just to give you an idea, Medicare wants you to take care of yourself, and they want to make sure that you don't let things slip by. So the first thing you do, we have 12 months after you enroll in Medicare for a free wellness visit with your provider. After that, once a year, you have a wellness, just check in, make sure everything's going well. Flu and pneumonia vaccines are covered under Part B. So as long as you're enrolled in Part B, they would be covered. And then other screenings like mammograms and, I forgot what it's called. Colonoscopy. There we go. Those are covered. They're screening. It's not, if you're in the hospital and they require you to have a colonoscopy because of what you already have. It would not be would be covered in a different way. So but this is just a very short list. And these are things that are covered 100%. No copay, no deductible. Medicare covers it. Medicare, moving on to Part B, premiums. This goes up and down every year. Currently in 2024, a monthly premium for Part B is $174.70. And you pay that, and then every month. And if you're withdrawing Social Security, that will automatically be taken out of Social Security. If you're not taking Social Security at the time you enroll in Part B, then Medicare sends you a bill quarterly, and then you pay it directly to Medicare, which reminds me of something I always like to point out and make sure that you always open up mail that comes from Medicare or Social Security. Medicare and Medicaid services will be on the envelope. It's usually a blue return address. The first time I was on Part B, I checked my mail just before we were leaving on vacation, like literally the same day or going the next day, and I rifled through things, and I thought, oh, Medicare, I can pay attention to that when I came back. Well, I came back and I opened it, and it was my bill for Part B. So luckily, there wasn't a penalty at the time that I did it. So always open your mail from Medicare and Social Security. If this price seems overwhelming to you based on your income, there's an income level that you can get help with that premium if it's below the amounts here. $17.15 a month is your income as an individual, or $23.20 if you're filed jointly. There's also something called IRMA, and that is for those of you who are fortunate enough to make over these incomes listed here. And and then how much you pay over the $174.10 is based on your income, and that's determined again by Social Security, and it's reviewed every year, and it's based on your tax returns from 2 years previous. So if your tax statements come out over this amount, then Social Security will notify you that you have an additional amount to pay over the $174.10 or whatever the premium is that year. Okay, we talked about Medicare Advantage, and I said we kind of put that all by itself, even though it's ABC. And Medicare Advantage is one where everything is bundled into one package. Your Part B, and Part D, usually Part D, prescription drug plan, is all handled through a private insurance company. Instead of Medicare handling it, it's done through a private insurance company. And Medicare Advantage can be reviewed and changed during what we call our open enrollment period, which is October 15th to December 7th every year. So you can go in and out of Medicare Advantage. Unlike Medicare Supplement, we say you're dating your Medicare Advantage because you can change it anytime you want. But with a supplement that you'll learn later, you're married for life because of the guaranteed issue that we'll talk about. Moving on, so we've talked about A, B, and D. Again, these are just snapshots, and we'll go into more detail in a few minutes. Part D is your prescription drugs, and again, that's a part of a private insurance company that you are insured through. There's a premium attached to it, but you have a choice based on premiums and whether they cover your drugs and how much copay there is. You can choose among all of these. And you're dating your drug plan, so you can change those during that October to December period also. Part D covers some of the vaccines, the RSV, the shingles, and the measles, tetanus, diphtheria, whatever order that goes in. And important to know is that you have to be enrolled in Part D in order for the pharmacy to cover that. You have to be in a drug plan, because then they don't bill Medicare, they bill the company that you're insured with. Part D also has, as I said, has a monthly premium. And believe it or not, right now, this year, the range in premiums goes from 50 cents a month to $123.50 a month. So there's everything in between. Again, it's a lot of the premium is based on your prescription needs. That can be deducted from your Social Security check at your request. You decide whether you want it taken from Social Security, or you just let your insurance company bill you and you pay for that. Those people on the 50-cent one just say, I'm just going to pay my $6 at the beginning of the year and not worry about it. And you can do that at any amount too. You can just pay it all at once, or you can pay it monthly. Again, the extra help comes in. You'll notice I went through it so quickly, but the income levels for Part D for low income is higher. And so instead of the 17 something per month to qualify to have help with your Part B premium, the Part D is a higher level, both for the single and for the married couple. And IRMA is the same. Your income thresholds are the same for IRMA, whether you're in Part D or Part B, and have to add that amount to your payments. Okay, Medicare Supplement, or Medigap as we talked about, are private companies, and as we went quickly through how much it's going to cost for you, how much Medicare pays and how much will be left for you to pay. Medicare Supplement is a way to have some or all of those deductibles and coinsurance paid through a company. There's an annual, or there's a monthly premium for a supplement, just like there is for Part D, the drugs, and for Part B. You cannot have a Medicare Advantage and a supplement. It's either or. So Medicare Supplement, you have Part A, you have Part B premium, you have Part D premium, and copays, and then you have the Medicare Supplement that will fill in what Medicare doesn't pay for. So here are the parts again, just in summary. We have A, hospitalization, B, medical services, C, if you plan to go that way, it's called Medicare Advantage, where everything's bundled into one package, and then there's the prescription drugs. And Medicare Advantage doesn't most often includes a drug plan, so it would be in A, B, and that's why I listed A, B, and D. They have their own costs, their own premiums, their own core insurance. So here we're going to go quickly. I keep saying it over and over again because I know it's hard to keep track of. So we call it original Medicare if you decide to go the route of Part A and Part B, a prescription drug plan, and a Medicare supplement. If you decide to go with a Medicare Advantage, all of those are bundled into one package, and you work with a private insurance company for those. Let's talk a little bit more about Medicare supplements. It's by a private insurance company. You will pay a premium, and there's a 6-month period. So when you decide to enroll in Medicare and you enroll in Part B, and we'll talk about the timing for all of that. Once you enroll in Part B, you have 6 months to decide to go with Medicare supplement. And none of the companies can charge you an increased premium or deny you because of your health conditions or your health history. So we say, and that's the only time it's available to you without those stipulations. Otherwise, if you wait past those 6 months after Part B, they can turn you down. If you decide to switch, they could turn you down or increase your premium based on your health issues. That's why we say you're paired. Go ahead.
Could you explain to them if they're going to continue working and be covered under the employer plan, how that...
We'll talk about that. Okay, yeah, Twyla's going to talk about the timing of each of these based on when you decide to retire and any other insurance you might have. But that's a good question, so if we don't cover it, let us know, okay? Okay, this is a confusing part because we just talked about Medicare A, B, C, and D. And now we have letters again, but they're plans, and they're entirely, this is your supplement. So if you decide to go the supplement and pay a monthly premium and have a drug plan attached to it, the first thing you have to decide is how many benefits you want covered. And so they're listed up here. The first, up until you get to additional benefits, those are what called basic benefits. And you'll notice that there's an X in every plan except for the ones with percentages. And if the X is there, that means that's covered. That benefit is covered. So, but Part A hospital, it's 61 through 90 because Medicare pays 100% until you get to day 61 in your hospitalization. If there is a hospice coinsurance, it will pay for that. And then, so those are the basic benefits. And then you get down to additional benefits. So you decide, well, wait a minute, that means that those coinsurance days of skilled nursing starting at 21, the first benefits isn't going to pay that, and I want that covered. And so then you look for a plan that has an X in that box. See how that works? Another one, the Part A deductible, that $1,632, that's a big chunk of money, especially if you end up being in the hospital in March and then you don't go back again until September. Remember, you're responsible for another deductible. So maybe that's important to you. So you want to make sure that the boxes under each of the plans has an X in it. That makes sense? So the best way to look at it is if you want additional benefits, then go to the columns that have X's in everything that you want. And you'll notice that G here has X's all the way down except for Part B deductible. Okay? And if you look at Part B deductible, nobody covers that. That's that $240 deductible for Part B, your medical services. The thing to remember, because the supplement companies that are offered, there's a lot of them. And there's tens and tens of them. The thing to remember is if you go with company 20, number 20, it's going to have the same, if you go with plan D, let's say, plan D with company 20 is going to be exactly the same it is with any of the others, 1 through 30. Okay? So you don't have to base your selection of companies on whether their plan is going to be the same as yours. Their plans are going to be different because they move across. And some companies maybe don't have plan D, but they have G and some of the others. So that's supplement. Oops, I got upside down here. As I get more and more confusing for you, I want you to know, and I know I'm going fast because you have a limited amount of time, but the thing to remember is when it comes to making your choices and having the right personal information, that's where we as SHIP counselors come in. Twyla joins 5 other counselors here in Mary Greeley. What floor? Is it third floor? Where's third floor? Over over there. And then Joan Grabenstetter and I'm Dale Nickerson again, we do it at Green Hills Retirement Community. You don't have to be a part of Green Hills. They just offer the office space for us, and they have a receptionist that makes all of the appointments for us. So we encourage you definitely to come in before you make your decisions, and even if you think you know what you're doing, we'll walk through it with you and let you know. If you're totally confused, we have a lot of people that walk in that have just question marks and a whole list of questions that we go through with them. Okay, before I turn this over to Twyla, we're going to talk about this prescription drug plan, Part D. Again, it's offered by private companies, and the premiums, the monthly premiums change from company to company. So when you look at a drug plan, look for a drug plan, you're going to want to know how much that yearly premium, the monthly premium is going to be. Do they have a deductible? I haven't even looked at this year. I know that it has been $500 or $505 or something, so it's a high deductible. Are all of your prescriptions covered? You know, you can go through their list. You can go to Medicare.gov and go to Plan Finder and put in all of your drugs, and it'll let you know what companies would provide you with all of your prescriptions, and it'll tell you the deductibles. There will be co-payments, especially as you go up in tiers on the drugs. If usually the first tier are generics, and there will be little to $0 to $10 copay, but then you go up into tier 3 and tier 4, there's quite a bit of copay involved. In your insulin, if you have diabetes and you're on insulin, it'll be important to know that your insurance company that you're going with covers insulin at $35 a month. Pharmacies, this is a weird one, but they have, a lot of the companies have relationships with specific pharmacies, and the cost at one pharmacy, if it's preferred, might be quite a bit less than if you went to one that's not preferred or out of their network. And then, are there any restrictions? You might, when you put your drugs in, it'll tell you if there are any restrictions, like you can only have so many doses a month, or there's pre-authorization. They want your doctor to authorize that this is a necessary prescription for you, things like that. And those are usually up in the upper tiers, but that might be important for you because it's one more hoop you have to go through. So we've talked about your choices. They're actually, believe it or not, there's two choices. Original Medicare with a supplement and a drug plan, and then Medicare Advantage, that all of those are rolled into one. Any questions before we go on?
I had one.
Okay. Yes.
When someone's turning 65, so for the first time they're going on Medicare, is there a recommended time frame that they go see a SHIP counselor?
You're about 3 slides ahead of us. So, and that's what Twyla's going to do. So, yeah, that's a very important question, and we're going to help clarify all of that.
Does the benefit period begin on admit or discharge date?
Admit.
And it starts over again after discharge.
Yeah, starts again after discharge.
Days begin on discharge.
Right.
60 days after discharge.
Okay.
That's when you count, yeah.
Yes.
Where do you find the preferred drugstore list?
I didn't hear what, did you hear?
It's based on what insurance you choose. So if you come to see us, we'll put all your meds in. We'll put the pharmacy you want to use, and the plan finder will kind of rise to the top, which is best for you. And in there, then we can see which is preferred, which is standard, and which is out of network. So, and you can do that yourself, and we'll talk about that. You can sign up for Medicare.gov, and you would be able to do all of that yourself if you feel so, like you want to. But otherwise, we can help you with that. But yeah, it's when you choose the drug plan, you want to make sure that your pharmacy is preferred.
Yeah. It's a great little tool,
Yeah.
and we use it all the time, especially during that period, October to December, when you can also change the drug plan.
And if we schedule a private meeting, all those issues would be addressed?
Absolutely.
Thank you.
And if you stump us, we call Des Moines and they can help us. Okay, it's all yours.
What do I push? All right, so I'm going to talk about basically the Medicare Advantage program at this point. We'll get into enrollment later. So there's several different enrollment periods, so we'll get to that. So right now I'm going to talk a little bit about the Medicare Advantage. The biggest difference in Medicare Advantage is that you must live in the county or where the plan is offered. So Story County, if you live in Story County, and if you go through that booklet that we handed out that has the Medicare Advantage, and when all the companies are listed, you want to make sure Story County is up at the top where it lists the counties. And just because you buy it in Story County or enroll in Story County doesn't mean you can't go to Polk County to receive your care. So it's just where you enroll where the plans are available. So they say you pay as you go versus monthly, and that's true. There are some Advantage companies that have premiums. Generally, they don't, and you would probably be best served if you look for one that doesn't. And the other thing is pay as you go versus monthly premium. You will always have a Part B premium. So there are some plans, you'll hear it on television, there are some plans that pay for your Part B premium. We don't have those in Iowa, so it could be another state, and maybe someday we'll have it in Iowa, but right now you still will have a Part B premium. That does not go away. So your plan will manage your A and B part benefits. So when you are receiving care, your bill will go to the Advantage company, and they work with Medicare. Medicare actually funds these Advantage companies. So your Medicare dollars are going to these private insurance companies to take care of you. So they'll manage your Part A and B benefits. You want to stay with a network, which is another thing you want to consider when you enroll in an Advantage plan. They have networks of doctors, networks of hospitals, and it is advantageous for you to stay within the network because you will pay less money than if you go out of the network. So there's always variables to some of that. There are some companies now that, that they'll pay the same whether you stay in or out. But you want to look at that. You want to consider your network. You want to consider who you see as a physician. Look to see if that physician or a group of physicians is in the network. Okay? I'm going to slide in here. It doesn't say it, and I think it's coming up later, but I find it to be very important. There's an HMO plan and there's a PPO plan. So the HMO, they don't pay out of network benefits. So you really want to look at that when you're considering HMO versus PPO. So if you're going to travel or if you get your care, maybe at Mayo or wherever you decide to go, an HMO might not pay anything, and then you're going to be responsible for all of it. A PPO will often include out-of-network benefits. It might cost you more for that out-of-network benefit, but they will still pay something. So it's something you really want to look at and consider. Another thing about these companies, they like prior authorization. So Medicare sets forth the rules, and Part C has to follow the rules of Medicare. So if Medicare offers it, they should too. The difference here is that Medicare allows your provider to interpret the rules, whereas these Part C Advantage plans, they interpret the rules. So often they'll say you have to get a prior authorization before you can have that MRI or that hip replacement or whatever it might be that they are requiring a prior authorization. They then go through the algorithms of what Medicare has set forth, and they determine whether or not you qualify. So there's that. It might delay some care briefly, and usually it's the doctor's office or the providers who have to do that prior authorization. That's generally not up to you, but you are, you're the one waiting and wondering and wanting the care and that sort of thing. So prior authorization is big with the Advantage companies. Most of them include drug benefits, and you want to make sure that when you're enrolling that you do get that drug benefit with it. We'll do the same for Advantage plans as we do for the drug plan. We'll put in all your medications. We'll make sure that your medications are being covered. The pharmacy you want to use is in the network. So that too can all be found on Medicare.gov. We'll talk about that at the end, how to get to that. One thing about Advantage plans is they want to keep you well. As I said earlier, Medicare funds these insurance companies, so your Medicare dollars are going to them, and they want to keep you well. So they do offer a few more benefits. They will offer dental, vision. Sometimes they give you passes to healthcare clubs. Silver Sneakers is a big one. They do things to keep you healthy. They might give you a stipend to do over-the-counter things like lotions and cough syrups and that sort of thing. They might say who you have to go to, but they might offer $25, $50 a month for that kind of thing. So they do give a few bells and whistles. But you want to make sure, again, with your dental and your vision, that your provider is in the network. And you might have to travel to go to a provider that's in the dental network. They often have a max on what they'll pay, so a lot of them have like $1,000 for dental, and that's all they'll cover is $1,000. I mean, that's a lot of money, but it might not cover everything. So again, be aware. A big thing is you do not need a supplement and a Medicare Advantage plan. Okay? All right, so kind of a review here. Should your path be Medicare Advantage or original Medicare with supplement? So things to consider, we handed out that Advantage booklet. Look at page 5. There's a checklist for people on Medicare Advantage, page 6. Just take a look at that booklet if you have it. And, read it in your spare time or, when you're bored or whatever is your best time to read information like that. All right, any questions at this point? Yes?
Maybe I'm getting ahead of myself, but if I'm wanting that Medicare Advantage Part C and I'm paying for that, what am I getting for that $174 premium on Part B that I have to pay?
You're getting, well, again, Medicare funds these companies. So you pay the premium dollars probably go to these companies. I don't know how they break it down. And you've paid in your whole life, right? So the free part. So all of that, they fund the companies through Medicare. I guess the reasoning behind it is now Medicare doesn't have to administer the plan. And so there's financial savings there in the Medicare program. And these private insurance companies, they are in it for, they're a private. They like to keep their money, right? So you would still pay it. You still get the benefit. The money is rolled over.
I don't get any benefit from that Part B.
Technically, you do. It's just through the Part C plan. So Part C is going to pay A and B, kind of similar, but yeah. So, yeah.
So basically what the government did is they gave them money.
Yes.
They figured out what the cost for Part A was and what the cost was Part B.
Yes.
Monthly. Then they turn around and said, Wellmark, Blue Cross Blue Shield, United Healthcare, Aetna, whoever it is, we'll give you that money for every person that enrolled in a Medicare Part,
Exactly.
Part C. So now they administer all claims.
Yeah.
The inpatient, the outpatient, and everything else.
Right.
Where under a supplement, Medicare processes claims and then sends it to your supplement.
Yes. So you still get the benefit. It's just in a different way.
Okay.
Yeah, it's rather complicated. So to review your choices once again, you can have original Medicare and a supplemental with a Part D, or you can have a Medicare Advantage plan. And then once your Part B starts, there's a 6-month window for anyone 65 plus to choose a supplemental without health questions, no underwriting. With Medicare Advantage, the plan manages your care, prior authorizations, networks, et cetera. And if you're in a Medicare Advantage plan, you must use their plan card. So you will get a red, white, and blue Medicare card, but that is not what you present at the provider. You are now presenting your Advantage card. It's a one and done. If you have Medicare supplement, you do the original route, you're going to have your Medicare card, which has A and B on it. You're going to have your supplemental card, and then you're also going to have a Part D card. So you're going to have three different cards that, you're going to lay down when you go to your provider. Probably not the D, that's just at the pharmacy. But if you have an Advantage, you just have that one card. So you want to tuck away your Medicare card, keep it in a safe place. You do not want to get rid of it. It is still important to you, but you want to put it in a safe place. Any more questions on Advantage? Okay. I would say here that there's no wrong way to go. It's the way you choose. And it is a big decision. And I think it's on a slide, so forgive me if I repeat. But when you first become eligible for Medicare, you do have a trial period of an Advantage plan of a year. And then if you decide within that time frame that you don't want it, you can go to the supplemental with still no underwriting. So there's that. The difference there is generally when you're healthy, the Advantage plan looks very very attractive because you're not paying that supplemental insurance. So that first year, it could be a trial period, but might not be your best trial period. When you get ill and you use it more, it might be more of a, now I really know what it's about. But by then it might be too late to get into a supplemental because a supplemental can then underwrite you. I hope that's not too confusing. It is to me, so you can tell how I stumble that it's not just. Okay, so initial eligibility. So we will talk about people who decide to work on past 65. So hang on tight, we will talk about it. Right now, we're going to talk about initial eligibility. Initial is when you turn 65, all right? Or if you have disability, you can read the slide there. Okay, so we're talking about when you first turn 65, you decide to go on Medicare, okay? So you have a 7-month window right before and right after your eligibility begins. So 3 months before, the month of, and 3 months after. When should you see us as SHIP counselors? See us in that first 3-month period. Okay, that's the best time. This is a time to make decisions. If you're going to continue working and if you want, other health care coverage besides Medicare, or if you want an Advantage plan, this is a real decision time in your life. First of all, am I going to retire? I mean, that's a big one, right? And then, okay, now I'm going to retire, so now what about Medicare? If my spouse is employed, do I go to Medicare or do I stay on my spouse's insurance? There's that possibility as well. So you do have several things to consider. So enrollment in A and B, let's say that I retired at 62. I decided to take my Social Security benefits, stayed on my spouse's, or maybe I'm working, stayed on employer insurance, okay? So I'm enrolled in Medicare, or in Social Security. So when I enroll in Social Security, I turn 65, I will automatically be enrolled in Medicare. There's nothing I can do, I'm automatically enrolled. So the card should arrive in the mail about 3 months before eligibility begins, or if you're not on Social Security and you turn 65, then you need to enroll yourself. So, if you are Medicare eligible and retired and not covered by a working spouse, you enroll in Medicare, you enroll in additional coverage, you enroll in a Part D or a Medicare Advantage, you protect your Medicare card and make sure all monthly premiums are paid, and Medicare is always primary if you have retiree coverage. Okay? So if you're 65 and still working, you may want to delay parts of Medicare. If you're actively employed, that's a very important word, actively employed. If a current employer is primary coverage and they have 20 plus employees, they need to keep you on. If they're less than 20, they can choose whether or not to keep you on their employer insurance. They might ask for you to go to Medicare. So delaying Medicare. So let's say you're working and you want to delay parts of Medicare. You can delay Part A, and if you have an HSA, you will probably want to delay because there is a tax penalty if you enroll in Part A. And so, yeah, you're not supposed to have an HSA and Medicare. They don't like that. So there's some tax penalty. Talk to your accountant. I can't tell you what that is. And then you may want to delay Part B if you have coverage through active employment, whether that's yours or your spouse. And then you don't want that premium. There's a $174 premium each month. There's no reason for it because, yeah, you have other insurance. And Part D, if you have drug coverage that's as good as Medicare, you don't need that. So you want to make sure that your employer offers drug coverage that's equal to what Medicare would offer. Okay? Any questions? I feel like that was a little bit rough.
I have 2 online questions.
Okay.
So Is it true that if you were born after 1960, the Medicare age rises to 67 instead of 65?
That is not true. That would be a Social Security issue. Full benefit for Social Security changed, but not Medicare. Medicare, still you can trigger Medicare at the age of 65.
And how can we get the booklet if we attended remotely?
There's a place online that I can direct you to, and I'll do that at the end if you don't mind.
Thanks.
So let me just say, so if you're on Social Security, it automatically will deduct. If you don't want to take Medicare, and that's where I think I missed a piece. When you're 62, you'll automatically get signed up for Medicare when you're 65. If you don't want it, make sure that you follow the instructions on the back of the card and send it back to Medicare, okay? Because if you don't want to enroll in Medicare, you need to let them know if you have employer insurance through a family member. All right, so now I'm going to talk about the special enrollment period. This is when you decide not to go on Medicare at 65, whether you continue working, whether you have it with your spouse. And now I decide I want to retire. Let's say I'm 67, 68, who knows what age. Now I decide to retire. Now you've gotten into a special enrollment period. So once again, you can enroll in Medicare and you won't have a penalty for late enrollment because you've been continuously covered through an employer insurance. But now I want Medicare, so I'm into special. So you have 2 months to enroll in the drug plan, and you have 8 months to enroll in B, and you have 6 months from Part B effective date to choose a supplement without health underwriting. And you really don't need to remember those dates if you just transition from one to the other. You don't want a gap. Like, who would want to wait 8 months, to enroll in B if you've lost your insurance 8 months earlier? So you want to make a smooth transition. You want to plan ahead. You want to go right from your employer insurance and start on Medicare. All right, so we're going to review a little here. You're automatically enrolled in Medicare if receiving Social Security. If you have coverage through active employment, you may be able to delay parts of Medicare. You have limited time to make choices once you retire or the person covering you retires. Retiree insurance is always second to Medicare. And if you are eligible for Medicare under age 65, you start over once you turn 65. So if you're on Medicare for disability, when you turn 65, you're no longer on it for disability, you're on it for age. Okay? One side note, you don't have to be on Social Security to receive Medicare. So if you want to start Medicare at 65, but you want to delay Social Security, you can do that. Any questions? There's several different enrollment periods. So we talked about initial, and that's when you turn 65. You decide you want to start Medicare. You've got some time windows there. Then there's the special enrollment. It's when you've worked past the age of 65, and now I want to retire. So you get into that special enrollment period. Both of those, you can sign up without penalties. And then there's a general enrollment period, and that's if you missed initial or you missed special. Then there's general. None of you want to get to the general. You want to do either initial or you want to do special. General, you might incur penalties. You just don't want to get there, okay? There are reasons people do, but you guys don't want to do that. So then there's the open enrollment period, and that only really speaks to the time frame between October 15 and December 7. And open enrollment predominantly, not exclusively, is for relooking at your drug plan and relooking at your Medicare Advantage plan. Drugs might change, pharmacies might change, plans change. We recommend yearly you revisit your drug plan and maybe make changes. We've saved thousands of dollars for changing people from one plan to another. So yearly, you want to look at that. Advantage plan as well, you also have a window of time from January to March to relook at Advantage. Advantage plans can be changed yearly too, same as drug plans. If you're on a Medicare with a supplemental, you know, you might be able to change your supplemental. That would be at the discretion of the private insurance companies. If they underwrite you, they might choose not to insure you. Then you're stuck kind of where you are. Okay? All right, so I'm going to talk a little bit about fraud.
It's 1221. You're 9 years.
Ooh. Guard your card. You know, it's like your Social Security card. You don't want anyone to know your Medicare number. Don't answer unknown calls. If you do talk to someone, track their name and number. Medicare won't cold call you. Social Security won't cold call you. If you call them or you trigger them with an email, they might return your call, but they will not just randomly call you. Open your mail, report unexpected health packages, review your Medicare notices for proper charges and services. Okay? All right, here's the Medicare.gov. This is where you all can go and create an account if you want. You'll be able to track your claims, your Medicare card. You can search for providers. You can enroll in a Part D plan or a Medicare Advantage plan there. And we would help you with this. So if you look at it and you're like, you know, come see us. We'll walk you through this. If you feel comfortable, you know, go for it. But you can get on. There's just a host of information there that's very beneficial. So don't be afraid to at least develop an account and get in and look around.
So can you do that without enrollment?
Good question. You have to have your Medicare number.
Oh.
Yeah, you have to have a Medicare number to get in. You can go in and look anonymously. You don't have to have an account. You can still go in and play around. You just won't get specific information about you. Like you could put in your drugs and it would tell you the pharmacy, but it won't save it. It won't be specific. Okay? So yeah, that website will talk about coverage. There's just a lot of information in there. So Iowa SHIP, we're here for you. This is a statewide consumer line number. This is a website. Someone had asked, can I get that booklet? If you go to shipiowa.gov, that booklet that we handed out, you can find it online at shipiowa.gov. Okay. Newsletter you can subscribe to. Come see us. It's on Facebook, which, by the way, I couldn't get on this morning. I don't know what's going on with Facebook. Everybody else had that problem too. Good. I thought I'd been hacked. I thought maybe somebody took off with my account. Okay. We are your local. We're here at Mary Greeley Medical Center on 3rd floor. There's 5 of us. Linda, Bruce, Bob, myself, and Tom. And at Green Hills, and you have Dale and Joan. 2 more counselors are up at the top. Yeah. So there's a bunch of us. We are here to serve. And if you want to be a volunteer, we'd love that too. Come talk to us about being a volunteer. There is some training involved, some mentoring involved, but it's worth it. It's just wonderful to get to know so many good people and to feel like you're offering a service that you can't really find anywhere else. So we are volunteers. As I say, it is a free thing we offer, and happy to do it. Any other questions? Me, I am here at Mary Greeley. And you call Dale, or you call Danielle. I have it written down, by the way. Let me get the numbers for you. Okay, where did that go? Here we go. All right. If you want to get a hold of us here at Mary Greeley, the number to call is 515-239-2322. And you'll just leave a message and say that you want to meet with a SHIP counselor. Somebody will call you back. All right. Green Hills is 515-357-5000. And as I understand, you'll get a main reception. You just let them know what you're interested in, and they can book an appointment through that receptionist. Other questions? Is it really, is it somewhat clearer? Just a little bit? I I feel like I muddled through some of that. So if you're not sure, please reach out, okay? And go to that SHIP website. It's got resources, too, and the Medicare.gov. Just use your resources. Yeah, we don't have any evals, so. All right, everybody, thank you so much for coming. Yes.
So in case anybody doesn't know, my name is Becky. I'm the benefits coordinator here at Mary Greeley. So you can always go to HR and get a hold of me if you have more questions. I will reiterate, if you're going to continue to work and or carry your spouse on your insurance when you are 65, please make sure we're waiving Medicare Part B.
Yes.
Okay. I also, so disclaimer here, I used to work on the broker side of things, so I actually sold these individual supplement plans. The Medicare Advantage I ran as far as I could have from them, but they come with a lot of stipulations. I'm sorry. I just ran from them because maybe they were a little confusing. But anyway, I highly recommend if you are going to go on Medicare, go on a prescription drug card, get yourself in contact with an insurance agent.
Yes.
And insurance agents are getting paid by the companies to assist you in purchasing the right plan for you. The prescription drug card can be extremely confusing. Make sure that they are going to work with you every single year. Will you call me every year to go over my prescription drug list with me? And make sure that they do, so that you, once again, they'll go into this website, they'll put your information in there, and they'll say, okay, the prescription drug plan you have today is going to continue to work for you. Or they'll say, you know what, that drug list has changed, let's look at something else. So those insurance agents are really important, in my opinion. You're not going to pay them. The companies already have that commission built into their program or into their plans. So make sure you just have somebody who's willing to work with you every single year.
And I agree with her for the supplemental. You want to find a trusted agent. I mean, that's one thing I often will say. If you want to go supplemental, I cannot sign you up, but I want you to go to a trusted agent. I don't want you to answer the door and let somebody in and sign up. They might be legit, but go to a trusted agent. Now, with Part D and Advantage, we can walk you through that. We can enroll you in Part D. We can enroll you in the Advantage plan. So it's the supplemental. And as she said, your agent can do that as well. If you don't want just one, some agents only sell one insurance, right? So, for instance, Wellmark. We all know and love Wellmark, right? So some agents only sell Wellmark. That's the only one they can sign you up for. There are those who are independent. They have a broader range of plans that they can sign you up for. So, just know that you're not stuck to one. And also know that a supplemental plan, if you get the G plan, a G is a G is a G. It doesn't matter which plan you go with. The difference is the premiums. So there's just a lot. There's a lot. I feel like in this short amount of time. Come see us.
Yes, definitely. Utilize SHIP. That's what they're here for. Yes.
What did you say your name was?
Becky
Becky?
Jennings. 2168 is my extension.
Thank you.
Thank you, sir.
Anybody else?
Do you see people throughout the whole year or
Yes.
mostly through the open enrollment?
No, we're as busy throughout the whole year as we are through open enrollment. We try to ask those who are new to Medicare, if they're not coming on, during that open enrollment period, that they maybe wait or come earlier. Open enrollment, we're very busy. We kind of extend our hours a little bit, but no, we see people all year long. People are turning 65 all throughout the year, so we're there all year. Yep. And we offer a variety of programs. We'll be at the Ames Public Library in April. Where else are we, guys? We do some Iowa State, get ready, set, retire. McFarland, we're at McFarland. We're going to give a presentation. So if you want to come hear us again, there's a public one at the Ames Public Library on April 22nd. So if you want to hear it again, you'll have different, Dale will be there. You'll have different speakers. You might learn something different, Or you just have heard this once, it's good to hear it again. Sometimes what we missed the first time, we pick up the second time. So, but use your resources, please. That's the big thing. Don't go it alone. You don't have to.
Do you have a date for the McFarland one?
Joan, when is the McFarland?
It's in May.
May 4?
I don't have a date. Just a second. Let me look it up.
Okay, Bruce will, they are our speakers at the McFarland, Joan and Bruce.
And what are your hours at Mary Greeley and Green
May
Hills?
21.
May 21.
That'll be
Yeah.
online.
That will be online, yeah. Our hours at Mary Greeley are varied. There's 5 of us here at Mary Greeley. We all take, I'm usually available on Tuesday mornings. Bruce, I don't know, when are you?
Wednesday afternoon.
Wednesday afternoon. Tom is usually Tuesday afternoon. Bruce is usually on a Wednesday. Linda's usually on a Friday. So call that number. Those people know when we're available, where we have openings, and they can give you an appointment.
At Green Hills, where one or the 2 of us are available from noon to 4 on Tuesday and Wednesday. So we got the 2 days a week. Well, every other week. Good question.
All right, thank you so much for attending, I really appreciate it.
Thanks.